Hi, my name is Kelsi Batioja, and I'm a second-year medical student here at OSU College of Osteopathic Medicine at the Cherokee Nation. Today I'm going to present to you a project entitled An Analysis of the Evidence Underpinning the American Academy of Orthopaedic Surgery Pediatrics Clinical Practice Guidelines. This paper was published in the Journal of Pediatric Orthopaedics. Randomized control trials serve as evidentiary support for recommendations underpinning clinical practice guidelines with the goal of optimizing patient care. A knowledge gap exists within scientific literature when evaluating the methodological quality and reporting of these randomized control trials. This is especially notable within the American Academy of Orthopaedic Surgery Pediatric Clinical Practice Guidelines. Our objective was to evaluate the reporting quality of randomized control trials underpinning the AOS Pediatric Clinical Practice Guidelines by adherence to the Consolidated Standards of Reporting Trials or CONSORT checklist. We also evaluated those same randomized control trials for risk of bias using the Cochrane Collaboration Risk of Bias Assessment Tool. So we located all of the AAOS Pediatric Clinical Practice Guidelines using orthoguidelines.org. Each of the 3 guidelines were evaluated for randomized control trials cited within the references. A total of 23 randomized control trials were identified. Then those randomized control trials we evaluated using the CONSORT checklist and ROB 2.0. We obtained descriptive statistics, and multiple regressions were also used to account whether publication year, intervention type, funding, conflict of interest statement, and risk of bias accounted for a variance in the CONSORT scores. A Mann-Whitney U test was also used to compare CONSORT studies that were published before and after 2010, which is when CONSORT was released. So in results, mean CONSORT adherence was 69.8%. Items on the checklist of the lowest adherence included items 10, 23, and 24, while items 2A, 13A, and 18 showed the highest adherence. A total of 10 of the 23 RCTs received a low risk of bias rating, while 5 of the RCTs showed a some concerns rating, and 8 or 34.8% of those randomized controlled trials had a high risk of bias rating. There were no statistically significant associations in the bivariate regression analysis, and the Mann-Whitney U test also revealed no significant difference between studies published before and after 2010. So CONSORT adherence within randomized control trials underpinning AAOS Pediatric Clinical Practice Guidelines is suboptimal, and many of the RCTs received a high risk of bias rating. These CPGs are also relying on evidence in some cases that is more than 20 years old, making it largely outdated. Many of the RCTs cited as supporting evidence also have that high risk of bias. Increasing awareness of the CONSORT checklist will allow for improved quality and reporting, as well as risk of bias. Altogether, these CPGs may need to be more updated or expanded to include more recent evidence relevant to pediatric orthopedic, allowing for stronger recommendations and improvement in patient care. Thank you.